I became president of White Memorial in 1987. White Memorial was in a difficult time, and they asked me to go down there and see what I could do. Being part of Adventist Health Systems West, of course, we were one of many hospitals, and that organization had to make a decision. Can we continue to own and support White Memorial, or would we have to look at other options, selling or closing? We were not making any money. We could not continue to lose money as fast as we were losing money and stay as a viable institution. So that was the urgency. There were other hospitals that probably would have been happy to take up the slack. But we had a reputation that we had built for 75 years. And we thought we could continue to provide the kind of services that we thought the community needed. Everybody connected with White Memorial, particularly Frank Duper, who was president of Adventist Health Systems West at that time, wanted to keep it going and make it a viable institution that it had been for so many years. So there was a lot of changes that had to be considered, and we went through a rather rigorous evaluation of all the services and what we could keep, what we should keep, what the community really needed. We cut out some residencies. We refocused on the family practice residencies like obstetrics, gynecology, pediatrics, family practice, internal medicine. And we also restructured our whole services in the hospital, management, and all the way down through to reduce expenses, basically. I'm trying to remember the numbers exactly, but I think we were probably on the 4 to 6 million upside after 2 years, which is sustainable. But as I said, even that wasn't enough to do the development of the hospital that had to become. So 855 was the rescue of that, which has been able to take it from there. Yes, there were the stresses. But along with the stresses came the satisfaction of success, which I still have. Can't get rid of that. And it's one of those highlights in a person's life. It was in mine. But I want to talk about the other people that were involved in that too, because it wasn't just me by any means that made all of that happen. There were physicians who had been there for years, many of them associated with the residences. Some of them had to give up those residences. And that was a big change for the physician leadership. But people like George Kiprodakis, Ike Sanders, Leroy Reese, Tony Hirsch, I could go on. There's a long list of physicians that were there and really got behind the program. That, we brought in new management all the way down through vice presidents, and I have to mention the young people that came in that took the risks. Warren Tates, Al Deininger, Beth Zachary, Alan Rice, Kathy Rathel, Tammy McMahon Brailsford, young folks that were willing to get in and work. That's important. Couldn't have been done without them. And of course the employees there. That was their community, that was their hospital. And if you understand healthcare, change comes hard. And you have a lot of different interests. You have the physicians, you have the community, you have the employees. And it was a effort by a lot of good people. If you could see the hospital today, it's been largely rebuilt with new buildings, updated, new services, growing, successful. Some of the people I just mentioned are still there making it happen. And I did have the opportunity a year ago to go back and see what was there. I don't think I had been in the hospital for probably 10 years at that time, and it was amazing. It really was, to see what it is today, and then to think back that, maybe I had something to do with that. So That's very worthwhile. I just want them to keep up the good work, keep moving forward. That's my message, because there's a lot to do. And there's a good people there to do it.